One of the things that's always been interesting in my region is that although the District of Columbia and Baltimore City are only about 30 to 40 miles apart, there are a lot of differences in terms of drug use and other variables that we monitor. And so, for instance, with heroin, although we did see a shift and an apparent increase starting in Maryland and in Baltimore City, we're not really seeing that in D.C. It's much more mixed what is going on there. D.C. traditionally has always been more involved with stimulants like cocaine and now the newer synthetics that have started to really explode on the scene in our region as well as in other areas, while Baltimore has historically been involved with heroin and that kind of thing. And so, for instance, in looking at the treatment data, which is enrollments in publicly funded treatment programs that we get from the Alcohol and Drug Abuse Administration SMART system that the state of Maryland has been able to maintain for a number of years, we saw an increase in total enrollments, but we also saw an increase in heroin enrollments as well. And what was interesting was looking at some of the demographics of these enrollments, and that what I saw was that really what was driving the increase and reflecting the state trend was the city of Baltimore. That Baltimore accounts for about half of the enrollments in the state, which is different from what you would see if you looked at the prescription opioids, which, although they're in a similar category and have a similar effect on people, tend to show up more in the rest of the jurisdictions rather than the city. So in fact, it's the rest of the state that drives the state trend in that area for treatment enrollments rather than Baltimore City. However, in both cases, we did see a similarity in that the increase was coming from an increase in young adult users showing up for treatment, those that were in the 21 to 30 age range.